Well, I'll start with a question that people ask me all the time. And they'll say, how often should I get adjusted? And my answer is always, as often as possible, so that we make as much money as possible. It's a bad answer. And it's not the real answer. How often should I get adjusted? It depends. And it depends on several factors. So I'll give you a few scenarios. Someone that's 20 years old, super flexible, never had any back pain or neck pain at all. One day they sleep weird, wake up with a crick in their neck. Once, maybe twice, and they're usually good to go for, we'll just release them from care and say, we'll see it as needed. Other end of the spectrum, 55-year-old truck driver, not the best diet, not able to exercise a lot, and has been driving truck for 25 years. We're gonna take a lot of their money. It's a bad joke, I'm sorry. But with that population, what happens is you get spines that have been sitting in one place for hours and hours and hours, day after day, week after week, month after month, year after year. And then the spine just becomes more and more immobile, and they really get that degeneration and arthritis in that spine. So for the challenge for those patients is to just get that spine moving. It's a corny, goofy saying, but motion is lotion. Joints that move stay healthier longer. Joints that don't move degenerate faster. I'm not saying that if you get adjusted, you will guarantee that you won't get any spinal problems, or that if you do get adjusted, it'll fix all your spinal problems. But it's one piece of the puzzle. So that 55-year-old truck driver, that can be a bit of a challenge, but those that stick with it, those first few times when we adjust those patients, it's like going to war, right? Like, you gotta get the face paint on, you know, give yourself a pep talk in the mirror and be like, all right, here we go. And then it can be like adjusting a brick wall. I mean, getting those spines to move. We've had several that have stuck with it, and after 6 weeks, boy, that back really starts to loosen up. And those patients will report that they start to feel a lot better. Because once those joints start moving and get used to moving, then when we adjust it, the joints move easier. Those people report less pain. They report that they're sleeping better. And then they report that they're able to just do day-to-day activities with less discomfort. And what's interesting is a lot of them didn't realize how much pain they were in. They had become so used to their backs being so tight and so locked up that was just their normal. And so a lot of them came in and didn't realize how much discomfort they were really in.